Why don't people care about Parkinson's awareness, and what helps? Many people are surprised to learn that millions of individuals worldwide live with Parkinson's disease, yet awareness remains surprisingly low. Despite affecting over 10 million people globally and over 1 million in the United States alone, public understanding of Parkinson's is limited compared to other neurological conditions. One reason is that many people think of Parkinson's as just a tremor or shaking, but it actually involves a complex mix of motor symptoms like rigidity and slowness, along with non-motor issues such as cognitive changes, mood swings, and sleep problems. This incomplete picture makes it harder for people to recognize the disease in themselves or loved ones, delaying diagnosis and treatment. Another factor is that Parkinson's mostly affects older adults, and society tends to pay less attention to age-related illnesses. However, about 4% of those diagnosed are under 50, which means younger people and their families often feel isolated because awareness campaigns usually focus on older populations. The disease also impacts families and caregivers who may feel overwhelmed without enough community support or understanding. Many affected individuals worry about managing symptoms and planning for the future, but the general public often remains unaware of these struggles. Geography and demographics also play a role. Regions like the Rust Belt, parts of California, and Florida have higher rates of Parkinson's, but awareness efforts may not reach these communities effectively. Men are more likely to be diagnosed than women, yet campaigns often do not target all groups equally. The economic burden adds to the awareness challenge. The cost of medications can be around $2,500 annually, and surgeries can cost over $100,000. With total health care costs reaching billions each year, many people suffer silently because they lack resources or knowledge about available support. So, what can help increase awareness? During Parkinson's Awareness Month in April, organizations like the Parkinson's Foundation use various methods to spread information. They share educational content through videos, social media, community events, and printed materials. When people learn about the full range of symptoms and how Parkinson's affects daily life, they are more likely to recognize signs early and seek help. Sharing real stories from people living with Parkinson's makes the disease more relatable and humanizes the experience, encouraging others to learn and support. Community involvement is also key. Peer support groups and local events create safe spaces for sharing experiences and gaining knowledge. Educating healthcare providers is equally important because when doctors and nurses understand Parkinson's well, they can diagnose it sooner and connect patients with the right treatments. Increasing awareness about research opportunities, like clinical trials, empowers people to participate and helps scientists develop better treatments. Overall, raising awareness leads to earlier diagnosis, better care, and stronger support networks, which are essential as the number of people affected continues to grow. The future holds promise with ongoing research and advocacy efforts. As awareness increases, so does the chance for earlier intervention and improved quality of life for those living with Parkinson's. It is vital for society to understand that Parkinson's is a complex, progressive disease that requires compassion, education, and action. If you or someone you know shows symptoms, always consult a healthcare professional for personalized advice. By working together to spread accurate information and support research, we can make a real difference in the lives of millions affected by this condition.